Good afternoon, everyone. Good afternoon, Frank. Thank you for this interview and coming here. Today we have to talk about a very interesting topic about the complication.
Yes.
We know from the literature, from our life, that the amount of surgery is increasing.
Yes.
With the amount of increasing surgery, increase the complication which we saw. But this topic is not so popular. No one don't want to discuss it. And my first question, is it possible surgery without complication, and what to do to avoid it?
Yes, a surgery without complication is not possible. It's just not possible. That is a dream, that is a phantasm, but obviously we will have complications. We will have complications. And the goal is to minimize, to mitigate the number of complications. How to avoid complications? The first is to have a very strong core of knowledge in anatomy, physiology, to know the procedures, to have a rehearsal, to have a simulation on models, etc. And that is the way we educate people now in medicine and dentistry. But another issue we have to discuss also is to put the surgeon in his real environment, where he is a patient, which is sometimes difficult, where he is himself. Sometimes you are in good shape, sometimes you are not in good shape. You have your environment, you have the nurses, you have an assistant, and we call this topic, this concept, human and organizational factors, and that is a new way of seeing the surgeries in the medical field and dental field, and the goal is to decrease the number of complications.
Next question is, what do you feel is the age, gender, and to say experience influence on the complication? What do you think about this? What the literature tells us?
Yes, about the experience, obviously, if you have 20 years of experience, you have less complications compared with a novice. The gender is a very interesting topic. Very interesting. A very recent papers has clearly demonstrated, and the papers was about 1.2 million patients. 1.2 million patients. And they have compared the mortality in surgery, comparing male surgeon, female patient, male surgeon, male, female, male, female, female. And the worst situation is when the male surgeon operates a female.
Why so? What's going wrong?
Probably because in a culture, the male surgeon considers that when a female complains, it's because problem of hormonal or psychological problems and does not consider the reality of the pain, and that now we have to dig a little bit more because the paper is very recent, but that is a reality. And other paper survey was done analyzing 150 different papers comparing the female and the male, not only in medicine, in all the human activities, and the female has less complications compared to the male.
But from the other hand, we see the situation that in our industry, amount of the female is increasing.
Yes.
Which means that we are expecting less complication, but also could it bring us to the situation, for example, when we not treat the patient the right way because we are afraid of complication or we are not ready to face some difficult kind of treatment?
Yes, you put on the table a very, very tricky question. Is when we have to stop, when we have to refuse a surgery and to put the balance advantage, risk. And for example, 2 days ago, I have placed implant on 85-old patient, 85, and with a severe Alzheimer disease, cognitive disease. And that could be surprising, but we have removed teeth and placed implants. That was a very tricky surgery. Everybody was concentrated because we had no time for this surgery. But imagine that we take out the teeth of this patient and she has no fixed denture. The life for her stopped. because she will forget to put the denture, she will lose a denture all the time. We know that. So we have to put in a balance the risk versus advantage. And I was very lucky to be part of a very long retrospective study with the Brandmark Clinic, and 28 years, 23 different surgeons, and 11,000 implants. 11,000 implants, 23 surgeons, 28 years. And in this study, we have clearly demonstrated a difference between the male and female surgeons. Less complications with a female. But the reality is, at that time, 20 years ago, 25 years ago, when we used short implant in the posterior maxilla, we increased the risk of failures. But who care about the failures of short implant in the posterior maxilla? And in that situation, for example, if you want to increase your number of success, the rate of success rate, you refuse to place the short implant. But in contrario, maybe you decrease the quality of life because in 90% of the case, your patient will have one teeth more. So it's a very interesting discussion, the benefits risk.
Yes, and to continue this discussion, I want to ask you about the other phenomena. I say, like, we in the books have the Department of Complication, and what we expected that this department will be very popular, and the people share with their complication, I discuss it, but it is not that way. And we see, even when we have possibility to post it like anonymous, people don't use it. How could you explain this? Why people don't talk about the thing which is really very important and could happen even with the experienced people?
And because so far, complications in our culture is a fault. It's a mistake. And when you have a complication, we have to blame you because you are not a good surgeon. You are not a good practitioner. That is more or less what we have behind our spirit. And if we want to change, we have to change the opinion leaders. They have to start to show in the podium there are fantastic cases, but also some cases which are not so good, or sometimes they have failures. And in aviation, for example, it's just normal to talk about failures, problems, and errors. Errors is not a fault. Our brain makes an average of 4 to 6 errors per hour.
Really?
Per hour.
It's not
per day, per hour. So errors is just a part of our cognitive way of working. So we have to talk about our errors. We have to share our errors. But for a novice practitioner or medium practitioner, it's very difficult to put on the table a membrane exposure, for example, because he is a little bit scared to be criticized. But if you try to understand why he had this complication, why? What was the problem? Maybe time pressure, maybe the clinical examination was not so good, maybe, and we can help the community to improve.
And today we have very tricky topic also in our session. What the highlight of this session? What practitioner can take home message from this session?
Yes, today we have a session, and thanks a lot for the Osteology Foundation for allowing us to organize a session with 10 practitioners coming from all around the world, very well-known practitioners, and they will share their own problems, complications, mistakes, errors, and they will explain why they did a surgery under time pressure and with a bad result, why the exam of the CT scan was not so tricky and they had mistakes, a complication, why we have complications. And that will be probably the first time in dentistry, the first time in international congress, big one to talk about the reason, the deep causes of our errors.
In our culture, it is like that the patient could suffer that he feels bad and something like that. But the doctor cannot suffering. How to say the patient that I'm not ready to do the surgery today? And the second question, how to say bad news to the patient?
Yes,
because
how to say no.
How to say no, yes.
And in the human factors concept, we work a lot on how to say no. We don't take off. Today, all the parameters are not in green, we don't take off. And except it in emergency, in the medicine, we have to learn how to stay on the ground, how to refuse to treat a patient. First of all, you need a very strong core of knowledge. And you must be trained, you need education and not Facebook education, I'm sorry to say.
But in your article in 2018, you're right that even people who has very good theoretical preparation and they have very good knowledge, they cannot realize it in terms of stress.
Yes, and so you need the knowledge in order to say no. You are not a good indication. Your situation is not for extraction implantation. I'm sorry, no. But to say no, you need the knowledge. You need to be able to. In human factors, we call situational awareness. You need to examine your patient to understand the measurement, and then you need to be able to change and to say, no, I'm sorry, I don't take off. And another way also is to tell to the patient, for example, before surgery, if you do sinus lift. Obviously, you do sinus lift, and as me, one day you have destroyed the membrane, totally. You have no membrane anymore. Imagine that you didn't tell to the patient that was a possible issue. And during surgery, you destroy the membrane. The patient is a difficult one, and you say, yeah, you will see that will be easy, no pain, no difficulties. In 6 months, you will have your implant, and you destroy everything. If you don't tell to the patient before surgery, that is a risk. We have a risk. Infection, membrane destruction. How do you deal? And you continue and you try to put a membrane, it's not fixed, and you have a big infection.
Yes, and you have a terrible complication.
It's always better to tell before than to justify.
Yeah.
Yes.
This is very good tip for the young practitioners. And you have several books, right?
Yes.
One is medical field, the other is human factors.
Yes.
What is drive you to do this, to write the book?
My story is I have a very classical education in surgery with my boss, Jean-François Tulane, and Paul Tessier. I stayed in this team for 3 years as assistant. But I was also private helicopter pilot in 19. And one day I did a stupid mistake, a real stupid one, and I crashed my helicopter during takeoff. And after this accident, I tried to understand why I did really a stupid mistake. We have not the time to describe, but that was totally, and why I was able to do so. I was a good pilot, I'm a very serious guy, everything was green, but I did a mistake. And I have discovered something just unbelievable. And the first book was with Bo Rangert, and we have analyzed all the clinical situation, 1 implant, 2 implant, 3 implant, maxilla, posterior, etc. And for all of them, we have analyzing the different parameters, like a checklist, and green, yellow, red. And the second book is the human factors, the human behaviors, how you react under stress, how you react with the pressure, how you can communicate with people. And that is the 2 facets of the success. Mm-hmm. The technical aspect, knowledge, education, but you have also to learn how to use your knowledge Monday morning, Friday evening, or if your kid is sick at home, if you have a problem with your partners, if the patient is difficult, we have to deal with all these different issues.
During these 2 days, I heard from the big stage in the halls, how to say it, advices for the young practitioner who are just starting their career. What will be your advice in several sentences?
My advice is take your time. Take your time. When we fly, when we learn to fly, we have a recommendation. For example, if you have less than 50 hours of flight, you cannot take off with a lateral wing up to 15 knots. I don't remember, but you have a recommendation. In dentistry, I was in a session one day, and a lady stand up, say, okay, I have placed 5 implants, I would like to do extraction immediate implantation. Please, your muscles must have the knowledge. Your muscles, you need time. You need time, and we have scientific basis, neuroscientific basis behind my recommendation, but please take your time. Don't rush.
Don't rush.
Don't rush, and find a good mentor, follow your mentor, and take your time.
Okay. And maybe I want to ask you the last question. Is it possible to do the surgery the birthday day or in the other the wedding day?
Yes. You make a reference to a very nice paper published 2000, maybe 22, 21, about 930,000 surgeries. 930,000.
In dentistry? No.
No, in medicine.
In medicine.
And no cancer, no emergency, only plain surgeries. And they have compared over the year the mortality of the patient in the 1 month after surgery, comparing all the day, but the birthday of the surgeon.
Of the surgeon?
Of the surgeon, not the patient. Birthday of the surgeon. Do you know what is the augmentation of mortality? Mortality is the patient pass away.
Frankly speaking, no.
23%.
Cannot be true. Why is this so?
23% more mortality when the surgeon operates the day of his or her birthday, and probably because interruption. You have the cellular phone and you reply. Cellular phone is forbidden in operating room, forbidden just in private office. And also because the surgeon leaves the clinic early for the cake and the party and let the assistant managing the patient. But the assistant, because of the distance of power, sometimes don't feel comfortable to change the prescription or to say, no, something is wrong with the surgery of my boss, and he closes his mouth, and you can increase the risk of infection complications. So it's just amazing.
It is amazing, yes, and it's so surprising, this result of this investigation, because I even don't think about this, like 100 of surgeons. Franck, thank you very much for this very interesting interview, for answering this tricky question.
Yes.
But this is what we have to know, and to pay a lot of attention on the complications. On the session,
See
and
you in
good luck.
session, and we are going to change your life.
Yes.
We can change your life, believe me.
And I want to ask you to make some notice here in your book.
On the book, yes. Thank you very much.
Thank you.